This is video number 3. This is really on osteoporosis. So bone turnover markers, there's a lot of confusion on bone turnover markers. Some people like it, some people use it all the time, some people don't, and use it only on specific patients. It's really good for compliance and to see if medication is working. So remember, keep in mind CTX, if you do check it, has to be done fasting. So drug holiday, is only for bisphosphonates because it lasts in the bone so long. So there's no, you can't say, oh, I'm gonna give you a holiday from Prolia or Timolose or Forteo. It's only for bisphosphonates. So along with that, so Prolia, so this is probably one of the main important messages. You just can't stop Prolia. You see worsening right away after you start Prolia. So weeks or months later, BMD goes up, gets worse about 6-10%. So you can't just stop it. So you got to change to an oral bisphosphonate if you can't do Timolose or Forteo. So zoledronic acid, so when we give IV to the hospital, this is the bisphosphonate, and so use it 2 months before you start Prolia. Okay, so again, this goes over the importance of can't just stop Prolia. So, if they can't afford it, if you plan to stop it for some reason, you got to give zoledronic acid 2 months before you start Prolia. Because it just takes that long to work, and those 2 months are very, very important. Okay, so again, you just can't start Prolia. If you start Prolia, you could do oral alendronate, and that's fine. When the dose is due, you can change over that day, and then you're okay. Use alendronate out of the bisphosphonates is probably the better one to choose out of the others. Timolose does have better data, so this was, again, one person's opinion, and, broke down the data, and it says, Timolose is better, so we should probably be using more Timolose. Not to say Forteo is not bad, but that was a message to write down. Hip BMD improves a year or two, after Timolose Forteo. So keep that in mind. The first year, the back improves, but the hip does take a while. So give it time for the hip. So P1MP is another bone turnover marker. And if you check it 1 month after Timolose or Forteo, it is a strong correlation with BMD a year later to see if Timolose and Forteo are working. So, we start Timolose Forteo. You can have them come back in a month and check the PN1P. Keep in mind, this will be high if they've had a fracture because bone turnover is high. So this is a marker of bone turnover, so keep that in mind. You want to wait 2 weeks before you give bisphosphonates if they've had a fracture to improve healing. Okay, so if they come in and I had a fracture last week, well, you don't want to start bisphosphonates. You want to wait another week or so. It's okay to use Forteo in CKD patients with normal PTH. Okay, and remember, every patient has CKD1 disease. So BMD and DEXA need to look at the X-rays to look for vertebral fractures. So we see this in the clinic all the time. So we see normal BMD, but then you look at the X-ray and you got so many compression fractures. So Prolia, remember, it can cause hypocalcemia and CKD.